Wellness is a lifestyle that creates a balance and happiness within all the aspects of an individual's life. The idea of wellness is different for each individual, but social practices create an influence on what we believe is important to the concept of wellness. As society shifts its focus towards a specific path, we, as people, will begin to incorporate that path into our idea of wellness. An example would be the obesity epidemic. The focus on weight loss and healthy eating is at the forefront of society, and there are now many interdisciplinary approaches to the concern. Businesses have become motivated to use wellness programs to promote healthy lifestyles for their employees. There are many wellness apps to track food, exercise, and emotional health. Wellness is also a force for social change. As a focus towards a specific concern is started, society will begin to change to satisfy the new movement. We have seen this force for social change with the move towards organic eating when the concern of pesticides, damaging business practices, and genetically modified foods were brought into the spotlight. Societal change also came when society was having to deal with a specific crisis. Smoking, drugs, STDs, texting while driving, and obesity have all become issues at various times. And when they were, society began to focus on the topics, and the creation of public service announcements started a driving force for change. The implementation of wellness plans in schools and businesses have also been a strong partner in the force for change. Wellness plans aim to create healthy lifestyles and to help in making any necessary changes. In the field of psychology, wellness plays a large factor. There is a significant connection between physical health, wellness, and mental health. If one of these factors is not doing well or is not being supported, then the others will suffer. An individual with a serious health problem will not feel a sense of balance and satisfaction in their life, and therefore will not have wellness. They also could be dealing with anxiety or depression over their health issue and will not have a healthy mental status. Wellness also has influenced the field of psychology by being a force for new models of psychology and counseling that are based on wellness. An example is positive psychology. Positive psychology is a new approach to psychology that believes that individuals are striving towards living meaningful and fulfilling lives. The approach is not to finding fault within a person that needs to be fixed, such as a mental illness or dysfunction, but to focus on what individuals can do to enhance their lives and create fulfillment. Wellness touches on many topics that we interact with and can have negative and positive effects. The topics of the obesity epidemic and unrealistic body standards are clear examples of the positive and negative aspects. Society is very focused on body image. We have obesity on one end and unrealistic standards of thinness on the other. If we look at the humanities on this topic, we will see that portrayals of body image can create unrealistic standards. The various art mediums portray the body image standards of the time that they were created in. This in turn will be what an individual may strive for, and as it is today, society's standards is for the women to be thin, which can create negative body image, which can lead to an eating disorder. The positive aspect is that this creates discussion. The portrayals in the humanities create discussion, and discussion can lead to societal change. Another example is in business. Businesses can often jump on social fads to make money quick. With the obesity epidemic, we have seen the creation of numerous lose-weight quick pills and products. There are always books being published about a new diet that is a miracle. The problem is that many of these products are not healthy or useful, and they can often be dangerous. Business can also make products that are positive and aid in creating healthy change. We can see this with a lot of new technology. We now have apps and devices that can track various health stats such as heart rate, sleep cycles, calories, and steps taken. This type of technology can aid not only in weight loss, but also in creating lifestyle changes that can produce wellness in an individual's life. The prevalence of mental illness in the criminal justice population is significantly higher than in the general population and has created a social and global issue. Ineffective mental health interventions and large economic disparities are not allowing individuals to obtain mental health services. Without proper diagnosis or consistent treatment, these individuals create a cycle of repeat offending and incarceration or institutionalization. The target population for this issue are those that are unable to obtain mental health services or are unable to afford them. This population is impacting the criminal justice system by repeat offending and participating in the overpopulation of correctional facilities. Recommendations for institutional changes are to promote more chances for intervention during the criminal justice process, the usage of more mental health courts, and adding more transitional steps to aid inmates as they re-enter society. Implementing these resources will be a benefit to other groups by creating more jobs, protecting the safety of others, and reducing the prison population, which will then decrease tax rates. An important strategy is the use of mental health courts. Mental health courts provide direct intervention for those that would be better served in receiving treatment. Treatment programs can include drug or alcohol programs, inpatient treatment, or day programs. The participants of mental health courts will gain such services as case management, therapy, medication, substance abuse treatment, and housing as needed. Mental health courts have been shown to reduce participants' probability of additional violent crimes by 55%. If an individual chooses not to use a mental health court or is not given the option, then interventions during incarceration need to be strengthened. Currently, mental health evaluations are typically done during routine physicals when an inmate is initially being processed for intake into the correctional facility. This is a very chaotic, stressful, and rushed time and inefficient and proper evaluation. Providing follow-up evaluations will allow for a clearer view of the inmate's mental well-being. When an inmate is found to have a mental illness, the treatment while they are incarcerated should be the standard level of care as would be provided to anyone. Inmates should also be taught illness self-management so that they are educated on their psychiatric illness and the importance of following their treatment program. Illness self-management will provide inmates with coping skills, relapse prevention training, and behavioral training which will prepare the inmate to transition back into society. A serious area of concern is for inmates with mental illness to continue to receive services after release. Inefficient release programs can lead to interruptions in treatment, unstable housing, and confusion for the released inmate. Release programs need to include a comprehensive plan that includes housing, treatment, and case management, and the plan must be started and prepared for long before the release date. Communication between providers within the criminal justice system and outside of it needs to be improved so that treatment courses are not interrupted. Case management must also be extended after release to ensure that the plan is being followed. The implementation of these plans will not be quick, but will certainly be worth it in the long run. The creation of more mental health courts in the criminal justice system will be a necessary first step so that those with low offenses can receive proper treatment for their mental illness. Corrections staff members will need to be provided with the proper training to become aware of warning signs for mental illness. This will allow them to refer inmates for proper evaluation by psychiatric staff. The number of psychiatric staff members will need to be increased in correction facilities to allow for proper psychiatric care. The creation of more community programs that would work with corrections inmates to slowly integrate them back into society would benefit the release of inmates. The implementation of these combined resources will provide many benefits. The first is that those in the criminal justice system with a mental illness will be able to receive proper psychiatric care that they are in need of. This will aid in the problem of overcrowding in correction facilities, which will lower tax rates. Crime rates will also lower because those with untreated or improperly managed mental illnesses have higher rates of reoffending, and if they are properly treated, the reoffending rates will diminish. Communities will in turn be safer.